Hi guys, today I want to discuss with you how the lower jawbone recedes once the teeth are removed. Here I have a model which shows the progression of the resorption of the lower jawbone once the teeth are removed. As you can see, I have this when the patient has teeth. You can see the length of the bone over here is pretty long. Once the teeth are removed, the bone which is holding the roots of the teeth is called the alveolar process. It has no purpose for it to be there anymore since the teeth are removed. So as soon as the teeth are removed, we progress to this level. And when patients start wearing denture when they are at this level, they're putting all the forces onto the jawbone. Now, even if you're not wearing denture and you're gumming your food, you're still putting forces on this jawbone. Now, depending on the quality of your bone, on females, it's going to resorb faster than male. So you're going to get from this level to this level in a few years. Some patients will get here in 5 years, some patients will get in 10 years, depending on the density of the bone, of the quality of the bone. Then after wearing dentures for a few decades, in 2 decades or 3 decades, depending again the kind of food you eat, your quality of the bone, the density of the bone, you're going to get to this level. So once you get to this level, lower denture already is a hard prosthesis to wear and function with. So it's already hard when you were at this level to wear. When you reach at this level, it becomes extremely hard for you to wear the lower denture. No matter how good of a denture a dentist makes, it's going to be extremely hard for you to wear this your denture at this level. So we see a lot of patients in our practice which come to us to get a denture made. They complain that lower denture is not fitting well like it used to 20 years ago or even 5 years ago, because now they've reached at this level of jawbone where there is nothing for them to support the denture. So regardless of doing hundreds of relines on the denture, making them new dentures, it's going to be extremely hard to wear the denture. Even if you use a ton of denture glue, it's very hard for the denture to stay in place because there is nothing for the denture glue to stick the denture to. So there is no jawbone in there. Also, it's also very hard to do implants in cases like this. Sometimes we can do implants, sometimes we cannot. We take a 3D scan, a CBCT, to determine whether there is enough width of bone for us to do the implants. But even if we are able to do the implants, you do not get the results which you would have gotten if you had done the implants a few years earlier when you had this much bone. But it is still possible to do implants at this stage and give you